Hello everyone, our today lecture and what important point that I want to share with you today is about skin cancer. Actually, finding a skin cancer in early stage or screening of this kind of disaster that could be happen for you in the future. Actually, this lecture specifically is about the mole spot nevus on your skin that some of them could be the malignant lesion and make you to receive chemotherapy or radiation and spend all you have to survive. So let's diagnose suspicious lesion on your skin. The incidence of melanoma skin cancer, the most fatal form of skin cancer, is increasing faster than any other potentially preventable cancer in the United States. Keep it in your mind. So, about screening. Screening for melanoma refers to the routine examination of asymptomatic individuals to identify suspicious lesions that require evaluation to establish a diagnosis. There is a notable point that melanoma occur in sun-exposed and in non-sun-exposed areas. There is a significant risk factor for melanoma, skin of color. Also, there is a far lower incidence of melanoma among black patients. The 5-year relative survival is lower than for white patients. The same trends have been observed in the Hispanic American population who have a low incidence of melanoma but demonstrate a growing burden of disease and greater likelihood of presenting with advanced disease compared with the non-Hispanic white individuals. We suggest targeted screening of higher risk group along with focused patients and provider education on acral mucosal melanoma risk and warning signs in people of color. Our approach places a high value on melanoma detection among high-risk patients in the primary care setting. So, if a skin lesion is found, the clinician should make appropriate referrals to dermatology where possible for further evaluation of all lesions with prominent features of ABCDE rule. Let's see what ABCDE rule is. Asymmetry. Pay attention to this picture. Border irregularity. The irregularity of the border of this lesion and color variation. You can see some types of color in this lesion and actually diameter more than 6 millimeter evolution during the time. To uncover suspicious lesion, there is another sign, ugly duckling sign, a pigmented lesion that is visibly different from the others in a given individual. Another aid to diagnosis, Glasgow 7-point checklist. Other concerning signs or symptoms. First, itching. Second, bleeding.
Oh my god.
And lesion growing under a nail or as a pigmented line in a nail. Who is the high-risk patient? Are you? White adult, over 50, total nevus count above 50 and or presence of large atypical dysplastic nevi. Personal history of skin cancer. Immunosuppression, particularly chronic use of immunosuppressive medications such as those used by organ transplant recipients. And actually, who are sun-sensitive individuals and those with red hair phenotype. And actually, family history of melanoma. Next advice. Look at and be familiar with your skin and alert your clinicians if you know changing moles or other suspicious skin lesions. Actually, people with darker skin should be educated about examination of the soles, palms, and digits. So, last but not least, patient self-examination. In self-examination, particular attention must be devoted to a screening of the back, particularly for men, because approximately 1/2 of melanoma occur on the trunk on men and approximately 1/3 on the back. It is difficult to perform self-examination of the back, so partners, friends, or family may need to participate in the examination. To do self-examination, you need tools like mirror full length and hand mirror. Keep it in your mind that you should perform the skin examination in systematic order, entire front and back of the body, sides of the body with arms raised, palms, forearms, upper arms, and axilla, back of the legs and feet, toe web spaces, and soles of feet. Here we just tried to answer one of your questions. Please support us, subscribe, and share our video. Comment your question. We will answer them in future.